PDMP On-Demand Training.
Welcome to the information and training session for the Nebraska Prescription Drug Monitoring Program, or PDMP. In this video, we will 1. Introduce you to the PDMP. 2. Review the laws and requirements of the PDMP. 3. Explain who can submit and access the PDMP. 4. Show you how to use the PDMP platform RxGov. 5. Answer frequently asked questions. If you are watching this video as part of the registration process for the PDMP, you will need to return to the registration form to complete the registration process once the video is complete. Simply return to the page, click the box that you have watched the video, and complete the remainder of the form. Now, let's get started with an overview of the Nebraska PDMP. The PDMP is an electronic database of dispense information from pharmacies and other dispensers for patients with a Nebraska address. Nebraska requires that dispensers submit dispenses of all drug classes to the PDMP at least daily. This provides a comprehensive and timely patient medication list for clinician use. The Nebraska PDMP is authorized by Nebraska Revised Statutes 71-2454 through 71-2455 to monitor the care and treatment of patient medications, provide information to improve the health and safety of our patients, and help prevent the misuse of prescribed controlled substances. The Nebraska PDMP is administered in collaboration between the Nebraska Department of Health and Human Services, DHHS, and the Nebraska Health Information Initiative, Sync Health, to provide a medication query available to all prescribers and dispensers in Nebraska at no cost to them. The PDMP is a powerful tool when facing the complex overdose and drug misuse epidemic, including opioids, benzodiazepines, and stimulants. Although the Nebraska rate of overdose is lower than the national average, even one overdose death is too many. Reviewing a central repository of medication dispenses provides the clinician the full patient picture before prescribing a new or authorizing refills of a controlled substance medication. When faced with the demands of collecting an accurate home medication list and the challenges of medication reconciliation, clinicians can again refer to the PDMP for that comprehensive and timely patient medication list. This same list is valuable for medication adherence monitoring, case management, or medication therapy management. The PDMP calculates and provides certain patient safety alerts to the clinician as they review the patient's medication list. For more information about patient clinical alerts, visit the DHHS website at dhhs.ne.gov and search for PDMP training videos. The information obtained from the PDMP can support the clinician as they engage patients in conversations about appropriate medication therapy plans. Now, let's look at federal and state legislation related to the PDMP. Implementation of the enhanced PDMP was created through a collaborative relationship between the Statewide Health Information Exchange, or Nebraska Health Information Initiative, now known as Sync Health, and the Nebraska Department of Health and Human Services, DHHS. Collaboration with Nebraska Pharmacists Association, Nebraska Medical Association, Nebraska Hospital Association, Nebraska Veterinary Medical Association, in addition to pharmacists, physicians, and veterinarians across the state, have provided additional support for the PDMP. LB 471 was enacted in February of 2016 and became effective on January 1st of 2017. It requires pharmacies and other dispensers to provide daily reports of all dispensed controlled substances to the PDMP.
This includes whether they are dispensed in the state or to an address in Nebraska. Patients are prevented from opting out or having their prescription information blocked in the PDMP, as they could in the Health Information Exchange. Prescribers and dispensers have access to the system at no cost. A major enhancement became effective on January 1st of 2018, which required the daily reporting of all dispensed prescription drugs within Nebraska or to an address in the state. In May 2017, LB 223 was enacted, which made some changes to the 2016 statute, including the mandatory completion of PDMP training, allowing both prescribers and dispensers to authorize a designee, and requiring veterinarians to report controlled substance prescriptions starting July 1st of 2018. In May of 2019, LB 556 was enacted, which allows for participation in interstate data sharing and expanding options for interoperability through workflow integration with electronic health records and pharmacy dispensing systems within the state. Additional changes were made to expand reporting elements, including patient telephone number when available and patient identification, in order to improve patient matching. In addition to state legislation, the SUPPORT Act is federal legislation aimed at addressing the national opioid overdose epidemic. Section 2003 sets forth requirements for prescriptions for covered Part D controlled substance medications to be transmitted e-PCS electronically starting January 1st, 2021. Section 5042, the Medicaid Partnership Act, contains several criteria for states to meet legislative requirements for providers and PDMPs.
Now, let's go over who is required to submit information to the PDMP.
All pharmacies, both in-state and outside the state of Nebraska, that hold a pharmacy license, as well as delegated dispensers and physicians that hold a dispensing practitioner pharmacy license, are required to submit dispense information or prescriptions for all drug classes, both controlled and non-controlled substances, at least daily. Many submit prescriptions multiple times per day.
Nebraska veterinarians submit dispenses of controlled substances to the PDMP at least daily for their pet patients. This provides an expanded understanding of the controlled substances within the human patient's home. There are exemptions for submissions. Prescriptions given for immediate use for the purpose of inpatient hospital care or emergency department care are exempt, along with prescription medication given directly to a patient by authorized personnel. Pharmacies that provide durable medical equipment, contacts, prescription glasses, or medical supplies are also exempt from reporting to the PDMP. These entities must contact the state and provide an exemption form stating the reason they are exempt from submitting.
Next, let's talk about who can query the PDMP. First, Nebraska authorizes access to the PDMP according to the Uniform Credentialing Act. By law, only prescribers and dispensers, pharmacists, can access the PDMP. However, the state does recognize the benefit that auxiliary licenses provide regarding patient care and support. Because of this, other professions such as a nurse, veterinarian assistant, or pharmacy technician can gain access to the PDMP and use it under the managing prescriber or pharmacist.
Prescribers include licenses such as doctor, physician assistant, nurse practitioner, dentist, veterinarian, and medical resident. Prescriber delegates include licenses such as a nurse, veterinarian assistant, radiology technologist, and others. Dispensers are pharmacists, and dispenser delegates are pharmacy technicians. In the PDMP portal, also called RxGov, clinicians can manage the relationship between delegators and delegates. We'll talk more about how to set up these relationships later. There are multiple ways that the Nebraska PDMP data can be accessed. First, you can access the data through the RxGov portal. If your facility or pharmacy participates in PDMP workflow integration, data can be accessed through the EHR, EMR, or pharmacy dispensing software. Lastly, if your facility or pharmacy participates in the statewide Health Information Exchange, or HIE, medication information can be found there as well. By watching this video, you are on your way to gaining RxGov portal access. Here are the next steps needed to finish the process. 1. Complete the registration form after you watch this video. 2. Look for an email from Okta. This means that the state has approved your registration application and you may have PDMP access. Please note, this step could take up to 2 weeks. Number 3. Click the link in the Okta email and set up password information. After your registration is confirmed, you can immediately access the PDMP through the RxGov portal.
Accessing the PDMP. Once you have been granted PDMP access, there are a couple of ways to log into the PDMP.
First, you can go to the same DHHS website at dhhs.ne.gov/PDMP and click the PDMP Access tab. Scroll down to the link that says Current User Nebraska PDMP Login. Click the link and you will be directed to log in with Sync Health through Okta. For easier access in the future, you can bookmark secure.synchealth.org/.
Once you have logged into Sync Health and verified your account, you will see the PDMP tile. By clicking on the tile, you will be immediately placed into the PDMP and begin a patient search.
You can also access the PDMP through the Sync Health website at synchealth.org. Under Services, you will see a link to access the PDMP. This will take you to the same login page for Sync Health through Okta.
Again, once you click the tile, you are in the PDMP. Now, let's look at the PDMP platform and become familiar with basic functionality.
Once you have logged into the PDMP, you will see the patient's query screen. In order to perform a patient query, you will need to enter search criteria, such as the patient's first name and last name. Full names are not required but strongly encouraged to provide the most accurate results. Also, the patient's date of birth is strongly encouraged but not mandatory. To perform a partial name search, a wildcard or asterisk must be entered. For example, if you entered BAR asterisk in the first name field and Allen in the last name field, it would return anyone with the last name of Allen and the first name that begins with BAR. Date of birth is optional, but again, the more information included in the search criteria helps to provide the most accurate results. By selecting the Search Any First and Last Name Combinations, you will see results returned that may have been entered in reverse order by the dispenser. For example, Barry Allen would also return results for Allen Barry. You may also select the species to whom the prescription was dispensed to view only human, only non-human, or by default, all dispensed prescriptions for the patient or owner. After you have entered all your search criteria, select Submit. The query history displays the most recent patient searches performed by you and any of your delegates. A patient search can be repeated by selecting anywhere in the patient's row. This will return you to the patient query screen where you can select Submit to run the patient query. Nebraska can search several other states who share their PDMP data. Simply click in the box under Additional States to Query, and a list of current states and territories will appear. You may pick one or all if you feel your patient may have dispensed data in more than one state. Please note, not all states collect all medications, and some states or territories do not collect any veterinarian medications. Generally, each state or territory will only send back controlled substance dispenses. If multiple patients meet your search criteria, they are displayed in a pick list. You can either select Display All to choose all the listed patients in the search, or you can select specific patients. If the clinician feels that the patients displayed in the pick list are the same person, the clinician can request that the patients be merged. The clinician will select the desired patients to be merged and select Flag for Merge. They can also provide additional comments to be reviewed by the PDMP administrator. They will then click Submit to complete the request to merge the patients. When patient records have been merged, they will be displayed with a plus sign next to the patient's name. If you select patient's name, you can expand the record and view a detail screen where you will see a list of any previously merged patient information. Next, patient search results default to a 6-month time period. However, the time period can be changed to show as little as 3 months or as much as 24 months of information. Patient information dispense details includes the patient's alerts. These are the MME assessment, multiple provider episodes, and overlapping prescriptions. Each box has an information circle that, when the mouse is brought to rest over it, will give more detailed information about what the values mean. For more information on patient alerts, please visit the DHHS or Sync Health websites and view the Clinical Alerts training video. The Relationships tab displays the number of prescribers and dispensers or pharmacies the patient has seen in a selected time period within the patient query. If you wish to see only the number of prescribers and dispensers from whom the patient received controlled substances within the timeframe selected, select Show Only Compliance Dispenses. By selecting Grid View, you can see the list of prescribers and dispensers along with the number of dispenses from each provider. Because Nebraska collects all medications, there are a couple of ways to view prescription data. By clicking the circle next to all medications will be displayed within the selected timeline. By clicking the circle next to CDS, only controlled substance dispenses will be displayed. By clicking the circle next to non-CDS, only legend or non-controlled substances will be displayed. There is also a chance to click the Combined View or Split View, which is the default setting. In the Combined View, all medications, controls, and non-controls are displayed in order of the date last filled. The Split View separates controlled substances away from non-controlled substances, again by date last filled. Dispense records where the generic name, strength, and dosage match are grouped together to offer more concise and readable results. These records will have a plus sign to the left of the medication dispense line. To expand the record, simply click on the plus sign. Select the plus sign again to collapse the selection. Next, you see the RxGov Patient ID, which can help identify if you have flagged more than one patient profile to view. Each patient profile is given a unique patient ID. Following the ID, the date will default to reverse chronological order. You can sort the way date filled is displayed by clicking in the box. The ability to sort is available for all columns by clicking in the column heading. Dates sort by chronological order, names sort alphabetically, and numbers sort numerically. There is additional dispensation information for each dispense. In order to view this, you can select the blue hyperlink drug name on the dispense row to open to the dispense details. You can also scroll down to the bottom of the dispense details box to access the full ASAP history. There may be instances when a dispense record includes pets or non-human medications. If the patient is an animal, there will be a paw print displayed in the species field. Clinicians can include or exclude veterinary dispenses from their search by selecting Human at the beginning of the search.
Because many patient profile searches will be done by a prescriber delegate or dispenser delegate, let's look at how to set up the relationship between the two. Before a relationship can be set up with either party, the delegator, which again is a prescriber or pharmacist, and the delegate, which would be a nurse or a technician, must both have PDMP access. Even though the delegate will perform the patient searches on behalf of the delegator, the state must confirm that the delegate is a licensed individual and will maintain an individual PDMP account. After the prescriber or pharmacist logs into the PDMP, they will click Manage Delegates from the left side menu in RxGov. This will bring up two tabs, My Delegates and Add New Delegate. The delegator can manage relationships with the first tab. This will show all delegates that the delegator has agreed to be responsible for. The delegator can edit the expiration date by clicking anywhere on the row. Once the edit expiration date has been clicked, a box to alter the date will appear. Enter a new expiration date and click Save. To add new delegate, the second tab will let you query delegates active in the PDMP. You may search by delegate name or email address. Once the delegate you are looking for is found, click on the row, scroll down, and click Make Delegate. Again, you can alter the expiration date and click Confirm. For delegates, the same process is used. The delegate can see the delegators they have as active, inactive, expired, or pending relationship with, or they can add a new delegator. The delegate cannot change the relationship date with a delegator, but they can deactivate the relationship. If a delegate has more than one delegator, depending on who they are working with that day, or in which location, they will be asked to select a delegator after they log into the PDMP. The delegator's name chosen will display in parentheses at the end of the delegate's name at the top of the PDMP screen. If the delegate selects the wrong delegator or needs to change for any reason, the delegate can click on the delegator name and select another. For more detailed information, including how to audit searches performed by a delegate, please use the training video named PDMP Delegate Management, found at both the DHHS and Sync Health websites. When you've completed your PDMP session, please make sure to log out of the RxGov portal. This is located in the top right side of the screen. You can also close the internet browser or the browser tab to exit. Although the PDMP will automatically time out due to non-use, it is not recommended to leave your session unattended, as this could compromise the security of the system and could lead to issues with state or federal regulations, including HIPAA compliance. Also, always log into the PDMP using your unique username and passcode. Even if someone else has legitimate access to the PDMP, do not share your credentials with anyone. Lastly, Nebraska regulations state that prescribers, dispensers, and their delegates may only search for prescription data for patients with whom they have an active provider-patient relationship with. It is important to continue to follow state, federal, and HIPAA rules and regulations, and your facility or organization policies regarding protected health information for privacy and security reasons. Let's finish this training session by answering some frequently asked questions. Once you've reviewed a patient's medication history and have either found or suspect that there may be an issue, what should you do? First, confirm the accuracy of the information. Once confirmed, Nebraska DHHS has developed a provider substance misuse quick reference guide that includes screening tools, talking points, referral options, and other resources. When appropriate, discuss the information with the patient. This guide is available on the DHHS website. If prescription fraud or forgery is suspected, the PDMP does not alter the rules, responsibility, or authority of a prescriber or pharmacist in prescribing or dispensing drugs. The legislation does not change what you would typically do, allowing you to follow your organization's or business's policy. Is looking up a patient's PDMP information mandatory? No. At this time, Nebraska does not require a prescriber or pharmacist to look at a patient's PDMP profile. However, it is highly encouraged and has patient safety benefits. Can I give a patient their PDMP report? Nebraska Revised Statutes 71-2454 does not expressly authorize prescribers, dispensers, or their respective delegates to share PDMP data with a patient. However, the statute does allow for DHHS to release information to a patient. If a patient is interested in this information, please have them call or email Sync Health Support at 402-506-9900 or support@synchealth.org. Consistent with the purpose stated in the law, providers are encouraged to utilize the PDMP as a tool to discuss the information found with their patients, particularly if there is an area in which the provider feels the conversation is needed or that patient safety is an issue. Providers still need to follow the regulations, HIPAA, and/or business policies when it comes to sharing patient data. If another physician, pharmacist, or another provider requests PDMP data, the provider should obtain their own PDMP user account. Can I give a report to law enforcement? Nebraska Revised Statutes 71-2454 authorizes access by prescribers, pharmacists, and their designees for the purposes of preventing the misuse of controlled substances and monitoring the care and treatment of patients. The statute does not expressly authorize prescribers, pharmacists, or their designees to share PDMP data. Providers still need to follow their regulations, HIPAA, and/or business policies when it comes to sharing patient data. They should be directed to contact a Nebraska DHHS representative at 402-471-3121. There are many resources available to prescribers, dispensers, and consumers. The Nebraska DHHS PDMP website has specific information to each group, as well as general information about the PDMP, training information, frequently asked questions, forms, the Nebraska Pain Management Guidance document, as well as other resources. For questions regarding the PDMP, please contact Sync Health Support Line at 402-506-9900 or email them at support@synchealth.org. Congratulations! You have now completed the required training video to gain access to the Nebraska PDMP. Please be aware that additional training videos are available on the DHHS website at dhhs.ne.gov/pages/PDMP-enhancements. From how to search for patients through interstate data sharing to how to use the PDMP medication list for medication reconciliation, the PDMP training videos are a great tool for clinicians. Now, please return to the registration form and complete and submit it. If any information is missing, you will be contacted by a member of the Sync Health support team. If you do not meet the requirements to gain PDMP access, a member of the DHHS team will contact you. For continuing education credits for this training video, please visit the DHHS website under Clinician Continuing Education. Scroll down and pick the PDMP link depending on your licensed role. Click the appropriate link and fill out the information. Thank you for taking your time and for what you are doing for patient care. By participating in the Nebraska PDMP, you are playing an active role in combating the drug overdose crisis and preventing overdose deaths in Nebraska.